Your Bladder and You. Our focus, Working Nurses in Hospitals or Clinical Environments by Teresa Dersheimer, Indiana State University nursing student. Learning objectives. At the conclusion of this lesson, participants will be able to enhance your understanding of how the bladder works, identify and respond to signs and symptoms of dehydration, recognize and correct the signs and symptoms of dehydration of self and others, apply behaviors for lifelong bladder health. Please stop and take the attached pre-test and assess what you know. What does the bladder do? Your bladder is a hollow organ in your lower abdomen that collects and stores urine. The bladder is fed by ureters, which are connected to kidneys, which filter blood and make urine to eliminate wastes from the body. The bladder empties via a urethral opening through which urine leaves the body. When empty, the bladder compresses like an empty balloon, a thick, muscular, fleshy balloon with connective tissue. During filling, the bladder stretches and fills much like a balloon. There are stretch receptors in your bladder to alert your brain that urine is present, but you are able to hold more and delay urinating at will. Your body has sphincters to control urine flow. What about urine? Dark urine can indicate dehydration. Normally, the first voiding of the day will be darker and continue to lighten up as the day proceeds. Holding urine in the bladder can expose a person to increased risk of a urinary tract infection. Urine starts as an acid and becomes more alkaline over time. This can attract bacteria. Nurses frequently have restrictions about having available water sources on hand. Therefore, nurses can have difficulty drinking adequate amounts of water. The bladder capacity is about 2 cups or 480 milliliters. Stretch receptors notify the person of the filling of the bladder. Urination can be delayed for a more convenient time. Nurses also have difficulty taking time to urinate and end up retaining urine for several hours. The bladder is a muscle and can stretch to hold more than 1 liter of urine. Prolonged stretching of the muscle weakens the muscle. Imagine stretching any muscle for hours, then when relaxation occurs, what would happen? For professionals like teachers, nurses, and even truck drivers who have limited access to a toilet over a decades-long career, this can have long-term consequences on bladder health. A weak bladder muscle can lead to urinary retention or even urinary incontinence. Nurse's bladder. In the Missouri State Board of Nursing newsletter, Marcus Engel describes nurse's bladder. He explains nurses are balancing their own health and comfort against the ongoing and imminent need of patient care. Nurses work to help others at the detriment of their own health. Nurse's bladder is another example of just how tough the job of nursing can be. It's not so glamorous, but it shows the level of commitment within this sacred field. Direct quote, Engel, 2015, page 5. What do you know about dehydration? Signs and symptoms of dehydration include confusion, irritability, fatigue, lack of urination or having dark urine, thirst, dry mouth or tongue, lethargy, inability to focus, headache, and dizziness. Shaheen, Al-Katani, Asiri, Al-Khodair, and Hussein, 2018. Inadequate water intake in a busy nurse can add up to brain fog. You can say, "What did I come into the supply room to get?" Brain fog forces you to substitute words like, "Look, it's a vibrating midget bird." talk about water. As a hard-working, busy, dedicated nurse, you always put your patient's needs first. Water is a necessity ingredient for metabolism, temperature regulation, and helps regulate acid-base balance. Healthcare workers are aware of the crucial role of water to their patients' health, but do not apply this knowledge to themselves. Here is a timeline of a typical day. Your actual hours may vary. Please note that the intake and output is gradual and continuous, like it would be with your patients. There are many events that go on throughout the day. Remember to take care of yourself, not first, but so you can last. Here is another flowchart. It just gets you to focus on drinking plenty of water and assessing the color of the urine, and then drinking until it's clear and continuing to drink. Other bladder information. Pelvic floor exercises called Kegels can help maintain healthy bladder function. Women are taught these exercises when pregnant. Men are taught these exercises after prostate surgery. In both cases, Kegel exercises can help with urinary leaking from sneezing or coughing, called stress incontinence. These exercises can also have a sexual function benefit to regular practicers. Kegel exercises are best performed after urinating or with an empty bladder to prevent reflux to the kidneys. The exercise involves squeezing the muscles between your legs that control urine flow. Imagine stopping your urine in mid-flow. Another way to target these muscles is to imagine trying to prevent passing gas. These muscles around your sphincter are the target areas to strengthen. The National Institute of Health website on Kegel exercises recommends performing these exercises 3 times per day, each while standing, sitting, and lying down. Perform the exercise 10 times, holding for 3 seconds each. 2014. Final points. Fluid in, fluid out. Drinking often enough to keep urine very pale is ideal. Drinking enough to need to urinate every 1 to 2 hours is good. More often gets to be tedious. Drinking more water in the daytime can reduce nocturia and interrupted sleep. Get it in early. If possible, aim to have consumed up to 1 liter before noon. Be kind to your kidneys. Replacements are hard to find. This is the list of references that were used in the creation of this education. Thank you so much for watching this presentation. I hope you learned something new and have information to change your behavior and possibly motivate others to take care of themselves. Please be sure to take the post-test at the end of this video and compare what you have learned. Thanks so much, and keep on nursing.